is there a particular age in which we should be extra careful about, the causing of piles or hemorrhoids, or can any age get this problem?
Actually, piles may occur at any age, but
Acha,
especially
okay.
when you are sexually active, like 20 to 40 years. These are the main age what
The
in
young
our
age.
young age. In this condition, we may get piles as we are more active. We do more work and we do like excess work, training work, and we do
Yeah.
traveling and all those things. So that's why these are the age 20 to 40 years, the main age we get piles.
How to prevent it from happening? You already have answered, but what do you need surgery? At what scenario do you need surgery in piles or hemorrhoids? I mean, how worse can it get, so that now you know that, okay, so we can't now stop it with the regular medicines and by going to hospitals and by drinking enough water or taking enough fiber. So now I think it's time for a proper surgery or operation. So at that time, I mean, how do we know about it?
So basically, in piles there are four stages: grade
Uh-huh.
one, grade two, grade three, and grade four. In
Okay.
first and second grade, you need to go for surgery. In first and second degree, symptoms like pain, bleeding may occur, and even constipation may present. At these stages, we can control with medicines and changes in diet and physical activity. So,
Okay.
in third and fourth stage, in these conditions, piles may come outside the anal region or may persist outside the anal region. Even on
Mhm.
pushing, it won't go inside. This is the
Okay.
condition where we need to go for surgery. This is sometimes it may leads to it may lead to emergency condition like strangulated piles that may occur. That is a life-threatening condition. So in third and fourth degree, a third or fourth grade piles, this is a stage where you need to go for surgery. And in
Okay.
first and second degree, we can manage conservatively with basic changes in diet, physical activity, and some medications like laxatives and
Mhm.
painkillers, like all those things.
Okay, okay, great. So also, doctor, what is the process of the surgery, and can piles or hemorrhoids be cured or treated permanently?
So there are many surgeries available. At present, there are many surgeries developed.
Hmm.
So
Okay.
for third and fourth degree, like hemorrhoidectomy, routine procedures like open hemorrhoidectomy, closed hemorrhoidectomy, rubber band ligation. There are many, even laser
Yeah.
piles. There are many different surgeries available in the
Hmm.
present scenario. We can't say what is the best for
Okay.
individual patient. Surgery, only one surgeon may decide what surgery is best for the patient. In our institute, we do Kshara treatment. This is a completely Ayurvedic treatment where we do a simple transfixation of the anal cushions, like hemorrhoids, whatever the hemorrhoid which is collapsed. We do
Hmm.
transfixation with Kshara. This is the best simple procedure. This is daycare procedure. You can go to your work on second day onwards. Chances of recurrence is very low in this condition, in this type of surgery, and even minimally invasive surgery and daycare procedure and very cost effective. There are no complications involved in this Kshara treatment.
So I was saying that how many days does it take for this surgery to be, I mean, so that, the surgery has taken care, I mean, has been taken care properly, and the surgery is fully done, and now the patient is fully cured or fully treated.
Okay. For any surgery, especially anorectal surgery, if you do any kind of surgeries like if you
Hmm.
do hemorrhoidectomy, open hemorrhoidectomy, closed hemorrhoidectomy, DGHL, a laser, whatever,
Yeah.
basic minimal time is 10 to 15 days needed to complete recover from the surgery. So you
Hmm.
need to take rest for at least 1 week. Then you can
Okay.
be completely cured of surgery or whatever wound occur due to surgery. So basic time is 10 to 15 days.
Okay.
It may be increased if you are suffering with any
Okay.
other diseases,
Yeah.
like if you are suffering with diabetes, hypertension, or any other cardiac issues. It may increase like 10, 20 to 30 days, some in some patients.
Okay. Also, doctor, when a patient has to, go down surgery and have to take that road, because the problem is not getting cured easily with the medications and everything. So when a person has to go down surgery, is there so talking about the hemorrhoid or piles, as we call it. So is there any side effect of the surgery, or is there any risk involved in the surgery afterwards?
Basically, there is no risk involved in surgery, but
Okay.
proper dissection while doing the surgery is very important.
Mm-hmm.
Mainly in pile surgery, complication may occur when if surgery is not done properly.
Mm-hmm.
Sometimes when we are doing hemorrhoidotomy, uh, excess tissue may involve. It may lead to stricture of the anal region. Sometimes it may get infected and it leads to abscess formation. Like it may ultimately lead to fistula and ano. So we need to do very carefully. Otherwise, there is no specific complications involved in the hemorrhoid surgery.
And doctor, it was not mentioned in the questionnaire, but still I want to clear this confusion for the people who don't know, especially women. So, does surgery or operations of hemorrhoids or piles for a woman can be problematic for their pregnancy, or can it hamper their pregnancy, or can it become an issue in their fertility?
No, no, there is no issue involved in the fertility. But
Okay.
in pregnancy time, you can, most of the pregnant ladies may suffer with piles,
Okay.
especially in the fourth or fifth month, and even last month, say eighth, ninth months, patient may suffer with the piles. But we can manage with conservative, like laxatives, some medication. We can manage with this. But there is no involvement of the fertility.
Also, does the surgery or operation also hampers the daily routine of a person, like exercises or traveling or all these things? Does it also affect it or hamper it?
No,
I'm talking
no.
about after the surgery is done.
No, nothing happened. Nothing like
Okay.
this happened. But
Okay.
patient must take care of himself. Like
Okay.
you have to avoid excess traveling. You have to avoid long hours sitting. You need to
Mhm.
avoid strenuous activities, because
Okay.
all those things affect on the freshly wound occurred due
Hmm.
to surgery. That may leads
Okay.
to delaying of the wound healing. Wound healing may delayed, and
Hmm.
sometimes it leads to bleeding, and it ultimately leads to like increasing of the pain. Sometimes it may get infected and it leads to abscess formation there. So post operatively after surgery, patient has to take care of himself at least 10 to 15 days until the wound is completely healed.
Doctor, also, is there any particular food that a person should avoid if they are going down the surgery, or if they are having problems of piles or hemorrhoids?
You need to avoid spices and
Okay.
masala, especially excess masala, fatty, excess oily foods, and deep fried foods, refrigerated food, and cold
Mm-hmm.
food like cold drinks. These are the things you must avoid. And
Mm-hmm.
even you need to avoid maida products, idli, dosha, vada. These are the things you must avoid post-operatively. Even normal human beings, normal people should avoid.
Yeah.
Okay,
Mhm.
and you need to take excess water. Proper hydration is very important post operatively, and you need
Okay.
proper quantity of fiber, and
Okay.
you need to take these other things. Okay.
Mm-hmm.